Brainstem external features. Objectives. At the end of the lecture, students should list the components of brainstem. Describe the site of brainstem. Describe the relations between components of brainstem and their relations to cerebellum. Describe the external features of both ventral and dorsal surfaces of brainstem. List cranial nerves emerging from brainstem. Describe the site of emergence of each cranial nerve. Development of brain. The brain develops from the cranial part of neural tube. The cranial part divides into 3 parts. Forebrain subdivides into 2 cerebral hemispheres, cavities, 2 lateral ventricles, 2 diencephalon, cavity, 3rd ventricle, thalamus, hypothalamus, epithalamus and subthalamus, midbrain, cavity, cerebral aqueduct, hindbrain, cavity, 4th ventricle, subdivides into 1 pons, 2 cerebellum, 3 medulla oblongata. Brainstem site. It lies on the basilar part of occipital bone, clivus. Parts, from above downwards. Midbrain, pons and medulla oblongata. Connections with cerebellum. Each part of brainstem is connected to cerebellum by cerebellar peduncles, superior, middle and inferior. MB. Pons. Mo. Sagittal section of brain. Thalamus. Superior. Cerebellar. Peduncle. Midbrain. Cerebellum. Pons. Medulla. Functions of brainstem. Pathway of tracks between cerebral cortex and spinal cord. Site of origin of nuclei of cranial nerves, from 3rd to 12th. Site of emergence of cranial nerves, from 3rd to 12th. Contains groups of nuclei and related fibers known as reticular formation, responsible for control of level of consciousness, perception of pain, regulation of cardiovascular and respiratory systems. Brain, ventral surface. Showing cranial nerves attachment. Medulla, ventral surface. Ventral median fissure. Continuation of ventral median fissure of spinal cord. Divides the medulla into 2 halves. Its lower part is masked by decussation of most of pyramidal, corticospinal, fibers, 75% to 90%. Pyramid. An elevation, lies on either side of ventral median fissure. Produced by corticospinal tract, olive. An elevation, lies lateral to the pyramid. Produced by inferior olivary nucleus, important in control of movement. Nerves emerging from medulla, 4 nerves. Hypoglossal, 12th, from sulcus between pyramid and olive. Glossopharyngeal, 9th, vagus, 10th, and cranial part of accessory, 11th, from sulcus dorsolateral to olive, from above downwards. Pons, ventral surface basilar sulcus. Divides the pons into 2 halves, occupied by basilar artery. Transverse ponton, pontocerebellar, fibers. Originate from ponton nuclei, cross the midline and pass through the contralateral middle cerebellar peduncle to enter the opposite cerebellar hemisphere. Nerves emerging from pons, 4 nerves. Trigeminal, 5th, from the middle of ventrolateral aspect of pons, as 2 roots, a small medial motor root and a large lateral sensory root. Obducent, 6th, from sulcus between pons and pyramid. Facial, 7th, and vestibulocochlear, 8th, at cerebellopontine angle, junction between medulla, pons and cerebellum. Both nerves emerge as 2 roots, from medial to lateral, motor root of 7th, sensory root of 7th, vestibular part of 8th and cochlear part of 8th. Midbrain, ventral surface. Large column of descending fibers, crust cerebri or basis pedunculi, on either side, separated by a depression called the interpeduncular fossa. Nerve emerging from midbrain, 1. Oculomotor, third, from medial aspects of crus cerebri. Medulla, dorsal surface. The features differ in the caudal part, closed medulla, and the cranial part, open medulla. Open medulla. Closed medulla cavity, central canal. Composed of dorsal median sulcus, divides the closed medulla into two halves. Fasciculus gracilis, on either side of dorsal median sulcus. Gracile-tubercle, an elevation produced at the upper part of fasciculus gracilis, marks the site of gracile nucleus. Fasciculus cuneatus, on either side of fasciculus gracilis. Cuneate tubercle, an elevation produced at the upper part of fasciculus cuneatus, marks the site of cuneate nucleus. Shown after removing cerebellum. Open medulla. Cavity, fourth ventricle. On either side, an inverted V-shaped sulcus divides the area into three parts, from medial to lateral. Hypoglossal triangle, overlays hypoglossal nucleus. Vagal triangle, overlays dorsal vagal nucleus. Vestibular area, overlays vestibular nuclei. Shown after removing cerebellum. Shown after removing cerebellum. Pons, dorsal surface. Separated from the medulla by an imaginary line passing between the caudal margins of middle cerebellar peduncle. On either side, a sulcus divides the area into two parts, from medial to lateral. Medial eminence and facial colliculus, overlays abducent nucleus. Vestibular area, overlays vestibular nuclei. Shown after removing cerebellum, the dorsal surface of open medulla and pons lie in the caudal 1/3 and the rostral 2/3 of the floor of the fourth ventricle respectively. Pons. Open M. Closed M. P. Mo. Midbrain, dorsal surface. Marked by 4 elevations. 2 superior colliculi, concerned with visual reflexes. 2 inferior colliculi, forms part of auditory pathway. Nerve emerging from midbrain, 1. Trochlear, 4th, just caudal to inferior colliculus, the only cranial nerve emerging from dorsal surface of brain stem. Summary. The brain stem is composed, from above downwards, of midbrain, pons and medulla oblongata which are continuous with each other, with diencephalon above and with spinal cord below. The brain stem is connected with cerebellum through 3 pair of cerebellar peduncles. The brain stem is the site of cranial nuclei, the pathway of important ascending and descending tracts and the site of emergence of cranial nerves, from 3rd to 12th. Cranial nerves, with the exception of 4th, emerge from ventral surface of brain stem. Question 1. The cranial nerve that emerges from dorsal surface of midbrain is oculomotor, 3rd. Trochlear, 4th. Abducent, 6th. Facial, 7th. Question 2 regarding the medulla oblongata. The pyramid is lateral to olive. The hypoglossal nerve is the most lateral nerve emerging from it. The cuneate tubercle is lateral to gracile tubercle. The cerebellum is connected to it by middle cerebellar peduncle.